Welcome to the Green Table Talk, where we will have open and honest discussion about transplant. I'm your host, Jennen Johnson. Do you know how long your mom was living with liver failure prior to her telling the family?
Process it's so foreign, right? Like, how does one get a kidney? It was so surreal.
When I was going through my kidney failure, everybody came out. Everybody had an opinion. Everybody was a doctor. And so I had a whole bunch of suggestions. Do this fast, do that fast. You gotta cleanse, you gotta juice. So my question to you is any of this real? Welcome to the Green Table Talk. I'm your host, Jennen Johnson. Today, we are going to dive into a subject that seems a little taboo, or people don't really talk about this topic. I know I felt the exact same way when I was going through my transplant, pre and post-transplant, actually. And so today I thought I'd take this opportunity to dive in it a little bit more with my friends. Today, we are going to talk about transplant and intimacy. We have Fadia, and we have Brittany, and we have Kadeem here joining us. Hello, everybody. Thank you for coming.
Hello.
Hey, hello.
Now, I'm going to ask you to tell me a little bit more about yourself and your story, just for our viewers who haven't heard your story previously. Fadia, we'll start with you.
Yes, my name is Fadia Jerome Smith. I had my transplant in 2016. I was diagnosed with FSGS, which is focal glomerular. Nope, I'm messing it up right now. I said it before and I can't say it again. But FSGS is short of what it is that I was diagnosed with. And my sister and I entered this paired exchange program where we essentially swap kidneys. So a stranger was able to give to me, and my sister gave to a stranger because my sister and I weren't fully compatible. So one day we got the call, your transplant is on its way, and rushed to the hospital to get the transplant done. And years later, here I am sharing my story. Thanks for having me.
Beautiful. I'm glad you're here to share your story and have this conversation with us.
Yeah.
Next up, we have Brittany. So if you tell us a little bit about yourself. Hola, señorita.
That's all I know. I don't know anything else. My name's Brittany. I'm a post-liver transplant nurse coordinator at Toronto General. I'm also one of the hosts of the Living Transplant podcast, which is where I've met some of you. I've been a nurse with the transplant program for the past 6 or 7 years, and I thoroughly enjoy talking about the transplant experience with some of my patients and hearing it from their perspective and sharing their journey through their stories.
Beautiful. And you also helped me out during my journey as well. That's one of the ways that I know you. So yes. Welcome to the show. I'm glad you're here.
Thank you.
Last but definitely not least, we have Kadeem here. Kadeem, introduce yourself.
Hello. My name is Kadeem Morgan. I was diagnosed with cystic fibrosis a year after birth. The doctors didn't diagnose me right after birth because at the time it was literally unheard of for someone of color to have cystic fibrosis because it was considered a white European male disease per se. Being diagnosed with cystic fibrosis just meant that I had to undergo a lot of treatments due to deterioration of my lungs. Unfortunately, my lungs got so bad to the point where I needed a double lung transplant back in 2017, Easter weekend. The surgery went by really well. Recovery went by really fast. But unfortunately, last year I suffered a really I had a tough time with rejection, and that led to me almost dying, receiving another double lung transplant on the 25th of December. So my family has this running joke where they call me baby Jesus because I had my first transplant on Easter Sunday, and then my second transplant happened on Christmas Day exactly.
Wow.
I just get
Wow.
chills. I just get chills.
That's crazy. Kadeem, I need to have you come back to the show so we can have an episode specifically about you, because that is just that's literally a miracle in itself. But I'm gonna keep that to myself until the next episode. But welcome to the show, Kadeem. I'm so happy that you are here.
Thank you.
Yes. So, friends, as I've mentioned before, we're going to talk about transplant and intimacy, post and pre-transplant and intimacy. Now, I feel that this is a really taboo topic. I feel that not a lot of people talk about this. I know myself personally, I was going through a whole bunch of stuff and I couldn't really find anything about it. I noticed there's a lot of information about intimacy and cancer and how to deal with that, but I didn't see anything that pertained to me. And just to give you an example, these are the common sex problems before and after transplant. They include loss of interest in sexual activity, vaginal changes such as vaginal dryness, discomfort during intercourse, etc. Some women may experience vaginal dryness and infections after transplant. Many men have difficulty keeping an erection during their transplant period. And there's a lot of, the list goes on, pain during sex, et cetera, et cetera. Now, my question is, with all of these issues that can take place and do take place with a lot of transplant patients, why isn't it not talked about more? Why is it that you feel it's not mentioned while you're in the hospital? Because we all know that when you go to the hospital, you're seeing many doctors and nurses just repeatedly over and over again until the transplant. Even after the transplant, you're still being followed by doctors, etc. Why is it that someone wouldn't say to us, oh, by the way, this is what you can experience? We talk about the medications, we talk about, pre-surgery, how to prepare, we talk about all that stuff, but this, I think, is an important factor. So the question is, why do you think it's not mentioned at all? At least it wasn't to me, Fadia, I don't know.
Yeah.
But why isn't it mentioned while we're going through this process?
Yeah. Well, for me, it was mentioned in passing. So it's like, oh yeah, by the way, your libido is gonna decrease. And I think that was the only thing I heard, and I only heard it once. So I feel like maybe a reason why it's not something that we talk about with our transplant team or anything like that, because I don't think I don't think we're looking at the whole person, right? We're kind of just looking at, okay, you have an issue with your kidney, your liver, your lungs. We're going to just talk about that, right? Yeah. They did do, I don't know if you saw a social worker at some point to kind of just talk about how you're feeling and stress management to prepare, but it was really to just talk about the transplant, right?
Yes.
So I don't think we're looking at the whole person when we walk in, with the needs that we have. And for me, it was literally said in passing. So obviously, because so many things are happening, I definitely put it in the back burner, right? Until I'm experiencing it. I'm like, hold on a second. No one, how come I'm not prepared for this?
What's going on? And,
like talking to my husband about this talk, and he's like, make sure you tell them that this is so difficult. Like, this was the most difficult period of his life. Well, our, intimacy, our how we show love and so on and so forth. It was very difficult on him. So yeah, that's
well, I have to say that it was mentioned to you in passing. I didn't even get that much, to be honest. So you actually received something. I got nothing. And I did have, a social worker after the fact and, talk about your feelings and what have you. But like you said, you're going through all this stuff, so it really wasn't, in the forefront of my mind. Oh, I should mention that I don't feel connected with my husband. That wasn't anything that came up at that time, but I didn't even get that much, in passing, right? Say something. Yeah, go ahead. Brittany.
Yeah, I got two major points. One, I would say that one of the reasons why maybe it's not discussed is that, I'll speak for myself, I just don't know. Like, I'm like, I don't even know, like, not just how to approach it, because I mean, the only way to approach it is literally to ask. But like, I just don't know if people are maybe wanting to talk about it or if they're comfortable talking about it. I think in society as a whole, people just don't typically go and ask, what's your sexual health like? But I mean, obviously we're in a clinical setting and asking, like, we already asked like pretty intimate questions already. What's your stool like? What's your bowel movements? Like, we ask all those questions. I don't understand why we don't just like throw that one in there too. And then the other thing would be that there's like in the transplant, our transplant program is obviously so great. You have a problem with this, okay, we can refer you to this, or we can refer you to that. Like, we can refer and move people around to different delegate different issues to different departments, but there's no designated like department or person to even, like, if somebody, even if I said to a patient, what's your sexual health like, or what's it like before, like maybe we just got into that conversation and they had issues, I don't even know if I would know what direction to point them in. With that mental health, I can say, like, maybe they're like, oh, I'm feeling a little depressed. I'd be like, okay, let's talk about it. And then maybe we can refer here and like go to psych or whatever. But I actually cannot think of a designated portion or person or department or something. Maybe there is one and I just don't know. But
if there isn't one, maybe that's part of the problem. Like, that should be lumped in together with mental health, you know what I mean? That should be lumped into that category as well, because it's just as important as mental health.
Very
right?
Like,
So
yes.
And in that mental health department, there should be someone there. I don't know if it's a counselor, there should be someone there that could speak on this topic, because guaranteed, I feel that if it's put out there that, if you're having, intimacy issues, if you're having, any type of like libido issues, what have you, we have a department, we have someone that you could speak to about that as well. And I feel 100% if that information is out there, it'd be readily available to everybody and would be used in a heartbeat. Like, I don't think anybody would say, and turn their nose up at it or think it's a waste of money. I think it would actually be used, because it can't be just Fadia and myself. You know what I mean?
I'm thinking at the very least, like just a pamphlet, some literature.
Yes.
In that big binder that they give us, right? There's so much information on there. I mean, I took the time to read it, but that's just because like I wanted to read it. But if even in the table of content, there's like, okay, sexual health, how to take care or who to talk to, or at least if we know that we can talk and we can bring it up to the social worker, that I think that would be a place to start.
Definitely. So next topic, I want to find out from you, how do you feel would be the best way to address this topic with your significant other? Now, myself personally, it was easy for me to discuss this with DeRoy and explain to him, you know what, this is how I'm feeling. Or he might try to cuddle and I'm like, I'm not really feeling in the cuddling mood right now. But he understood, he got it. He was never like, what's wrong with you? Or like, he knew what was happening, even post-transplant, because, it might sound kind of silly, but we thought that after I had my transplant, everything would be perfect. So we'll be back to the way it was, no problem. Not so much. Wasn't like that at all. You know what I mean? But he was patient. He understood. Not everybody is in a situation like that. Some people might go through, they're trying to explain to their significant other and they might be like, can't you just try? Or if you say, I'm tired, I don't feel like it right now, or can we do this later, or whatever the situation might be, the significant other may not be as receptive to that. So how do you feel someone could explain this in such a way to their significant other that, this is not what I'm feeling right now? Like, how do you feel would be the best way to explain that? What kind of suggestions we could provide to make it easier for them to...
Kadeem, you're up.
No, that's
suggestions.
It's kind of tough because it really depends on the individual. I'm going to speak personally. I really never had that kind of issue The main reason I say that is because since I have cystic fibrosis, I had to do a lot of procedures. I had a slew of surgeries throughout my whole life. I was under a lot of different medications, right? And a lot of those things are factors into having a healthy sex life, right? So whenever I was with someone, they always knew, okay, Kadeem is going through this, Kadeem's going through that, whatever, blah, blah, blah. So for me, it was easy because I already had that medical background, as I guess compared to someone who's just getting into the whole medical scenery with the transplant and whatnot. Like I have the medicine history because of cystic fibrosis. So for me, it was always a lot easier than some may have it per se. Granted, sometimes it has been awkward, I'm not gonna lie. One of my biggest problems was the fact that I wasn't comfortable with my body because with a double lung transplant, you basically leave the hospital with a bunch of scars on your torso, right? So I would usually gear my explanation towards why I feel a certain way about my body, aka my scars, whatnot. I would try to help them understand like the psychological aspect that happens during a transplant and how you feel about your body as an individual. Yeah, that's how I would approach it.
Mm-hmm. That was actually my next question actually for the group about feeling insecure after transplant, because I also experienced that as well. Because with a kidney transplant, I have this big scar, right? And it's like right in the front, right? So for the longest time, I felt I was just walking around with like big t-shirts and during intimacy, turn the light off, don't want to have that scene. DeRoy didn't care. Like it was just all in my mind. He did not care whatsoever, but I felt insecure about it. And then I had the catheter. So, I have a mark up here, and then I have the scar on my stomach from the transplant. And then I got another scar over here where they enter it and it's just, like what Kadeem's saying, there's a lot of scars. Some of them are small, some of them are not so small for me. So I did have insecurities about that as well. So how do you feel that someone can kind of get over these insecurities? Like I said, with DeRoy, he was very reassuring for me. So I didn't have to worry about that at all. It was just me. I had to get it over, in my own mind. But someone else that's watching, like what advice would you say you could provide to get over that?
I just want to add something in there. Just listening to you, Kadeem, I was thinking like the word that rings like really loudly in everything that you said is to have that conversation, right? And to be completely honest with how you're feeling and how you're feeling here, how you're feeling in your heart, how you're feeling in your body, and to be like, hey, like it's not that I don't want you, it's not that I don't love you anymore, it's not that, it's literally like right now inside I don't feel okay, or I don't feel right. Our experiences are all very different, but also a lot of similarities, but it's having that conversation, right? So in our relationships, communication is key. It sounds taboo, it sounds cliche, I should say, but that's really what it comes down to. And sometimes you may have to say it more than once, and the conversation just needs to keep happening over and over and over again. But I think one of the things that I was doing was having the conversation in my head. Yeah. Right. I wasn't always sharing with my partner what I was feeling and what I was going through. So a lot of the times he was just kind of left guessing, why, we weren't having sex or why we weren't even cuddling.
Why do you feel you didn't share that with him?
So a little bit more about my story. So in 2010, we were pregnant. This is before transplant. This is before dialysis. Before I knew something was wrong, but didn't know, what it was. And then we lost our baby. So from that moment, I kind of had this thing in my head that my body failed me. Not only, I had fibroids with this baby, really big fibroids. I wasn't able to keep baby to term. And now I have my kidneys don't I have to get a transplant. My body is literally against me. But this is a conversation that I'm having in my head. And I was almost afraid to say it out loud, because then it would make it more real that my body did fail me. And I'm like, how, would he understand that, essentially, if I said my body failed me? Because I felt like it was such a me thing, right?
Yeah.
That probably did affect him, but not as much. So at first, a lot of it was right here. I just kept everything in my body, and like you said, the next thing you wanted to bring up was, the insecurities. So just like everybody here, scars there, and weight gain, and just not feeling like I feel good, right? I have energy, but I don't look the same.
Yes.
Right? I don't feel the same inside. So
I think we're one and the same, Fadia. I feel like
Yeah.
you're literally telling
every
my
time we
story.
talk, every time we talk,
Literally
that's the conclusion, right? We're like, oh wow, we're very alike. But
Literally.
yeah, so there was a lot of that, and I think it's just recently with the weight gain, with the COVID weight gain, I would kind of, be very, very mindful of the things that I say about my body. So the minute I start complaining about my weight gain, I'm like, Fadia, be grateful for this body that you have.
Yep.
Right.
So
Go
did
ahead.
any of you, I'm hearing a common thing between the three, but did any of you ever have anyone, not obviously not from the transplant program, but was there any type of support that you ever used to help with any of these concerns? Did you reach out to a sexual health clinic? Or was that an option? Did that even go through your head? Was it a doctor? Was it a psych? Or did you just kind of just work through it?
To be honest, and to answer Brittany, unfortunately, in the CF community, everyone's story is the same. If you have a transplant, your story is basically one and one the same, right? So I actually have, unfortunately, but fortunately, I have 3 other friends that went through not one, but 2 transplants as well, both male and female. When I was going through my stuff, I just felt the most comfortable talking to them about it, right? Because they probably understand me more than I understand me, because they already walk through. I'm walking in their shoes pretty much, right? They already went through that path. So whatever I was going through, I knew I could talk to them and they would completely understand me. They would completely give feedback. They would ask me questions. They would ask me why I feel this way, blah, blah, blah. And they would reassure me that everything that I'm feeling, everything that I'm thinking is to a certain extent valid. But at the same time, a lot of the stuff I find that we think in our head is not necessarily, I wouldn't say it's not common sense, but it's not the right way.
Yeah.
It's not the right point of view.
You got it.
Yeah.
You got it. Because we have the ability to your inner critic comes and starts telling you all these things that you fear. I've learned this in therapy. nurse aside. This is like your inner critic that's coming in and telling you that you can't do things based off of like whatever you experienced as a kid to help build up some form of protection. So of course we have the ability to like just skew things and convince ourselves of this is not possible, or like just like the anxiety, just twisting and twisting and twisting and twisting and twisting, whether it may be about body image or about like confidence or, you know, feeling wanted or whatever. But it's good to know that obviously like you had your friends that helped you out. But if I'm trying to like look at it from a perspective of a healthcare provider, how would in the future, like let's say you go through this again, or you have to start on a new medication, meaning like you're something happens, you have to start on a new medication and it affects your sex drive, or it affects how you feel. Things change and you need help. How do you address it? Who would you go to? How would you like to be? Like what would help the most?
Yeah. Well, while we were talking, I was thinking this is why this channel exists, right?
Yes.
This is why we have to, as a people, keep talking about these issues so that we can create these communities of support, so that you as a healthcare provider, you can be like, okay, there is this community of support that you can reach out and maybe ask a question there, right? Because it's, we're not, you know, like I don't know what you all do professionally, you know, like we all have our own separate lives, but when we come here, we have just like, I like what you said earlier, Kadeem, right? Like all of our stories are pretty much the same story, just, you know, like it's just in a Jennen body, it's just in a Fadia body, it's just in a Kadeem body. Knowing that, you know, Tom, Sue, and Mary over there are living through the same thing, but we're here, right? There is the YouTube channel. There's a mentor program where you can call Jennen and ask Jennen questions. I think it's creating those communities, I think would definitely be like an outlet for patients that may have questions, or just need somebody to talk to that have lived through that, through those experiences. Like Kadeem's, like, I think you're like, every time you say something, I'm like, wow, like, wow.
I know.
Wow.
Fadia, I know.
You know,
I know.
because
everything, the words that come out of this man's mouth just give me full body chills every single time. I'm like, oh my gosh.
Right. So like and like you said, like unfortunately, but fortunately, you know, you have friends that went through the transplant journey or on the transplant journey, but you have each other. Like, what? That in itself, you know, like it's beautiful to know that, you know, like you're not by yourself.
Exactly.
You're not alone. And just like you said, you know, they probably know you better than you know yourself. So when you're going through something or you're about to open your mouth to say, the scars, they're like, yeah, the scars. And then it's almost like a look, and then we know, like, yeah, we know. We don't have to say anymore because we have each other. We have each other's back, in that sense, right?
That empathetic connection that you get.
Yeah. And it's just, again, like, I'm kind of going on a tangent, but it's not really a tangent. That's why we need to see more of us, right? In you know, in healthcare. So that way we know that, you know, a sister over there, a brother over there, you know, can we identify with and be like, okay, yeah, we know exactly, you know, like if I'm giving a certain look, I'm like, yeah, okay, she's not comfortable.
You know what that means. Yeah.
You know what that means, right? Or, you know, the nurse is explaining something and the nurse seems to be frustrated with me because maybe there's a language barrier. I don't know, right? But knowing that there's another person of color in the room, persons of color in the room, like, okay, let me find a way to support this person. Let me find a way to support.
And like you said, that's where this channel comes in handy, because you could always refer back to this. And if we had somewhere where, you know, there's some like peer-to-peer mentorship or peer-to-peer, you know, like you said, I want to speak to Fadia, speak to me, you know, our situations are quite similar. So like you said, that would be a great idea. something that, where someone could turn to address what you were saying before, Brittany, in terms of, talking about, your feelings, what have you, and how do you get over those insecurities? I have an interesting story. So I was just fed up. I was just, this is after transplant. Like we're talking like a good few months now after transplant. I thought that I would just bounce back like that. I thought everything would be great, but it didn't happen. And so I went to my family doctor, and I don't know why I didn't think of this before. Maybe it was partially because, embarrassment, partially because of, I don't know the reasons why. I never really sought information. Like I said, I went online, I looked it up, didn't really find much. So I finally decided, you know what? I've been with my family doctor for eons, at least more than 10 years. So, and she knows what I'm going through. Like she knows completely everything in and out. So I said one day, I'm gonna make an appointment and go see my family doctor. Went over there to see her. And I said, here's a situation, before transplant, understandable as to why, you don't feel like you want to be intimate with your significant other, but it's been, a few months now. What is up? What's going on? And she laughed and she said, Jennen, can I ask you a question? And I'm like, uh-oh, sure. She goes, let's look at your list. Okay. You found out you had lupus. You found out you have kidney failure. You got a catheter placed into your neck. And then several days later, the catheter fell out. You went back into surgery, had another catheter placed down here, going into the hospital, dialysis 3-4 times a week, 4 hours of each time that you're there. You're a mom, you're a wife, you're still working, you're going to surgery. Oh, don't forget, you found out you had little tears, little holes in your lungs. So when you're doing dialysis, it's not actually doing its job. It's just filling up your lungs with fluid. You've been through so much. And then, of course, you have the transplant. Finally, hallelujah. What do you expect to happen? Do you think you're going to have sex in the forefront of your brain? Do you think you'd be just ready to go? It doesn't work that way. Like, you need to give yourself time to adjust, realize what happened to you. It's a mental thing as well.
Yeah.
You can't just spring back into there and just jump on the horse and you're ready to go. It doesn't work that way. You have to let yourself adjust. You have to let yourself breathe. You have to realize that a lot has happened to you over the past few years. And now you're just releasing. You're like, I got my transplant. Everything's starting to level back out again. It's okay. It'll work itself out. You're not broken. Because I said to her, I think I'm broken. I think something's wrong with me. Because we had the transplant. I got the new kidney. I feel great. What's up? She goes, you're not broken. This is just something, it's part of the process. The same way it took a few years to get here. It's not going to take a few years, but you have to give yourself time. And once she said that, and I knew this, that's the thing. I actually knew this, but hearing it from her, like you were saying, you have that support system, right? Hearing it from her, I was just like, wow, that makes sense. Stop stressing about it. It's like someone who's stressing about having a baby and checking their cycle and all that other stuff. It doesn't work that way. You have to let it happen naturally, right? So once I had my mind wrapped around that, I found that everything was much easier after that point. I just had to relax, let it be, just let go, right? So that's my story as to how I got over it. I just had someone I need someone to just hit me over my head, literally, and just say,
chill.
What do you expect?
Chill.
What do you expect? So rekindling romance. Now you're feeling better. You're back into the swing of things. You're trying to, get that romance, get that mojo going. What do you suggest?
You're having a bad gal summer. Just kidding. Sorry.
See, that's why I love Brittany. That's why I love Brittany.
You're like, all right, gonna have my summer. Here it is.
Ready to go.
How do I do this? Which way do I swipe?
Right? Like, how do you get back into the swing of things? Like, what do you do? You can't, especially now it's COVID, right? So like, what do you do? Do you have little romantic dates with each other in the middle of the living room? Do you,
what you said, right? Like your body just needs time to just readjust. Things shifted. So you just need to kind of be put back together and then make time. Now you just have to make time, right? I'm definitely someone who's like always on the go. I'm always doing something. And my sister was always like, Fadia, you're doing way too much. You're doing the most, Fadia. You're doing the most. You're doing the most. And after transplant, I'm like, okay, I need to change that about me, right? Yes, I'm still very extroverted, but then I'm choosing, like what I'm going to put my focus on, because there's only one Fadia at home, right? Will only has one Fadia, so let's make it, let's make the best of it. So creating those moments, like I would send my son to his aunt, right? So that we would have the house to ourselves, or we would go to a hotel and as loud as we want to be. The son wouldn't wake up and be like, "What's happening?"
I love it. I love it. Yes.
Do all the things. But it's like, for us, I think it's literally just we have to make the time, and slow down. Just slow down.
There's this I don't know if you guys have ever heard of her. She's the best. She's on Masterclass. This is actually what made me get Masterclass. But her Insta name is Sex with Emily. Have you've ever heard of her?
No.
Oh my goodness.
On it right now.
Oh my God. Okay. So Sex with Emily, she's just like a sex expert, but she's so fantastic. If you have a Masterclass membership, I highly recommend watching her entire series. It's really great. I actually messaged her because it wasn't on you. Fun tip: if you have Masterclass, you have to turn off like the parental, something in your settings, because I was like, I got Masterclass for you. Where is this show? And she was like, and she told me exactly how to fix it. And I'm like, thank you. Anyways, you said something, Fadia, that made me go, oh, I follow her on Instagram, and I was creeping her entire page the other day. And she also has a podcast. That's my girl. And there's a post that she posted a couple weeks ago that I saw, and you can't see that. It says, take the stigma out of scheduling sex.
Oh,
I'm like, oh, get it, girl. And the caption is, go ahead, put face sitting on the calendar, but seriously, scheduling sex can be hot. I'm like, yes.
Make a note. Okay.
Sex with, make a note. Yeah. But her Instagram is so freaking fantastic. She's got just really educational ways of talking about sex. So that would be my recommendation of how to rekindle love. She talks about it all the time, like how to get that energy back. But yes, scheduling sex, there should be no stigma.
I'm gonna have to check her out.
Please do. She has a podcast. She's got a Masterclass. She's got a blog. She's got Instagram. She is all over, and you can actually call her. There's a number that you can call and ask these questions.
And you speak to her directly, or is this
you can speak to her directly? You'll be on the show. It's so cool. I'm like, she's just go. I would the thing about sex, obviously, is that I feel like it's a very trendy topic to talk about, which is the best thing. At least on social media, there's so many sex therapists out there that are really Insta famous, I guess, but they're breaking the stigma of just talking about sex. I think her goal in life, it says it somewhere on her on her show, is to be able to make talking about sex as easy to talk about at dinner, with a bunch of people. And I'm like,